Okay, good afternoon, everybody. Um, I think that we're live in another 5 seconds, and I'll be starting the conversation almost immediately. Thank you for taking your time to join this very important conversation. My name is Ayodele Adio, and it's a pleasure to welcome everyone to this important roundtable. Like I said, it's my absolute pleasure to welcome you to today's roundtable conversation as we will be commemorating the World Pharmacy Day for 2025. This year's global theme reminds us of the evolving role of pharmacy. And of course, our focus today is pharmacy beyond dispensing. And we will be speaking closely and analyzing financing and optimizing supply chains for better healthcare. And we'll speak directly to the unique opportunities and the pressing challenges of the health landscape. So as we're gathered here, not just to celebrate the immense contribution of pharmacists, but to also ask the important question, how can the pharmacy profession rise beyond dispensing to truly driving sustainable healthcare delivery? And the reality is clear. Medicines, no matter how innovative, cannot improve lives if financing is inadequate and if supply chains fail. And in many communities today, patients still struggle with shortages, delayed access, and high costs. And that's why pharmacies, hospitals, and healthcare providers often carry the weight of financial pressure that limits their capacity to serve. And yet, we know that when financing systems are strong and supply chains are optimized, healthcare access improves dramatically and lives are saved. That is why today's conversation is so critical. And we're fortunate to have in this room policymakers, pharmacists, supply chain experts, financiers, industry leaders, and health tech experts, all of whose voices, must work together if we are to transform access to medicines in Nigeria and beyond. So as the moderator today, my role will be to guide us through a very thoughtful and engaging exchange of ideas. And we will examine how financing models can ease pressure on pharmacists and hospitals, how technology and data can make supply chains more reliable, and how the pharmacy profession itself can take on a broader leadership role in delivering healthcare equity. So I encourage every participant to be open, to be bold, and solutions driven in their contributions, because this is not just another conversation. I believe that it's an opportunity to shape policy, to inspire innovation, and to create practical strategies that will strengthen our healthcare system. So once again, welcome to this roundtable conversation, and let us engage fully, challenge assumptions, and leave this room with the ideas that will move pharmacy and healthcare, beyond dispensing. So I look forward to a very robust exchange and to a very large extent, some intellectual judo. So very quickly, to usher us into the first step in our event today, I would like to quickly introduce and bring up stage the CEO of Medbury Pharmaceuticals, in fact, the entire Medbury Healthcare Group. I'd like to introduce her very quickly to deliver her opening address and speech, to usher us into the 2025 roundtable conversation. It's my esteemed pleasure to welcome upstage the Group CEO of Medbury Healthcare Group, Dr. Itunu Akinware, to deliver her opening address and to open the floor of the conversation. I don't know if she can hear me. Can Dr. Itunu hear me? Okay, I'm not sure that Dr. Tino can hear me. Okay, if you can't hear me, I think we'll just jump into the panel conversation before she comes up, and then perhaps Um, we'll take her address after the panel conversation. So I'll just quickly introduce the panelists so that we jump into the panel conversation very quickly. Um, so the first panelist is the head of business for Medbury Pharmaceuticals, Farm Yewande Adekoya. It's a pleasure to have you on, ma'am.
Thank you very much for having me.
Our second panelist is Dr. Gumbo, who is the medical administrator for our Jalad Hospitals. It's a pleasure to have you on, sir. Good
Yeah,
afternoon.
thank you very much. I'm happy to be here.
Um, Also joining us is Mr. Abiola Oshuniyi, who is a health expert who has a long track record in working in digital health space. Mr. Abiola, thank you for joining this conversation.
Thank you very much, and it's great to be here. Hello, everyone.
And I think we also have Azuka Okeke, who is the CEO of ARC. It's a pleasure to have you on, ma'am. Thank you for joining the conversation.
Thank you, everyone. It's good to be here.
Fantastic. Okay, so don't worry, you might not see me on the screen because I want you guys to all have the screen, but you hear my voice ask. Uh, okay, could you hear me earlier when I got off stage?
No, we couldn't hear you earlier.
Okay, I guess I have to be on stage then. Okay, that's fine. All right, so I think we'll start with from Yewande Adekoya, and I'd like to ask you the first question, which is as the head of business for Medbury Pharmaceuticals, how do you see the role of pharmacies evolving beyond the traditional model of simply dispensing drugs?
Thank you very much for that question. Well, we all know that in the past few decades, pharmacies are no longer just handing out medicine. They are basically, we are a healthcare access hubs, right? And the role is shifting from simply dispensing to being anchors of community health. So beyond dispensing, pharmacies can deliver services, preventive services like screenings, vaccination, chronic disease monitoring, and with digital platforms, ERP systems, um, for instance, our ERP system, our tech system in Medbury Pharmaceuticals, pharmacies are now largely becoming also data enablers, right? Offering real-time insight for clinicians, for payers, for policymakers. So in short, we are not just dispensers, we are care coordinators, data enablers, community anchor. So pharmacies are now playing in the advisory role in the supply chain financing. Every pharmacy should be seen as a first point of healthcare and not just a last mile of logistics. So these are the things that we are doing and that we need to scale to get pharmacy from just dispensing or handing out medicines, right, to thinking pharmacists and thinking health. Thank you.
Okay, that's a very thoughtful response to the question. And before I move on to the next panelist, I'd just like to do a follow-up question with you, which is that, in what innovative financing models, can pharmaceutical companies explore to improve affordability and access to essential medicines in Nigeria and beyond?
Thank you for that question. Right. So we understand that Nigerians' challenge is not just about supply of medicines, it's also very important and big on affordability. Access and affordability. And affordability is an important aspect as availability. Without financing, access breaks down. So we have, for instance, at Medbury Pharmaceuticals, we are rethinking financing in three major ways. Number one is supply chain financing model, which is one of our business models, right? And here we are sharing risk with manufacturers, distributors, providers, even patients themselves, so that patients don't face empty shelves, right? We are exploring models like automated pass split technology, whereby we are building transparency and trust, and ensuring that everybody in the value chain of providing healthcare gets paid instantly and transparently as patients pay. We're looking at co-payment and subsidy programs whereby we can partner with government institutions and we can create branded subsidized medicine schemes that cover the vulnerable while spreading the cost sustainably. Also, one of the great work that AkiSM, as our leader, Azuka is here, is doing is the group purchasing framework. Basically pulling demand across not just facilities but state governments, right, and pharmacies, so that there can be negotiation of better pricing. Manufacturing companies can properly plan for states, and they can bring in financiers, they can bring in supply chain financiers, they can bring in all the relevant key players that would play to fund the group purchasing framework. So these are things that we are looking at. So supply chain financing, innovative financing system is not just about business. It is a health equity tool, right? It ensures that medicines are both available and accessible. And we have to think innovatively to ensure that this is put in place today, tomorrow, and sustainably. Thank you very much.
Thank you for that very thoughtful submission. I can see that Dr. Itunu has joined us backstage. And Abiola, just hold the thought for a second. I was going to bring you upstage, but I would just like to quickly take Dr. Itunu for her opening address, and then we can come back to the panel conversation.
Hello, everyone. Good evening. Can you hear me? Can you see me? Okay.
Yeah, okay.
Can you hear me? And can you see me? This is my first time using LinkedIn. I actually didn't know that this was possible on LinkedIn, right? It's a I'm learning technology as we go along. But hello, everyone. It's a real pleasure to be here today. Um, I'm very excited to give the keynote speech this evening. But first of all, before I go into my speech, I've penned down, a few words to commemorate today. I just want to first of all say a big congratulations to the pharmacists in the house. For today, I'm joining you. I'm declaring myself as a pharmacist, even though I didn't study pharmacy, but I'm a pharmacist by affiliation today. So I just want to say, well done. You guys are a pivotal part of the healthcare value chain. Without collaboration within the healthcare ecosystem, we cannot serve our patients. And the pharmacy and pharmacists form a fulcrum, a very, very solid part of that healthcare ecosystem. So I won't take too much of your time. I've penned down a few words that I would like to share on today, and just speaking about, financing and optimizing supply chains for better healthcare. Um, First of all, I want to thank again my distinguished colleagues, partners in healthcare, friends of the pharmacy profession, everyone here, and ladies and gentlemen that are gathered here today. It's a privilege to welcome you to this roundtable, convened to mark the World Pharmacy Day 2025. Each year, this day offers us not only the chance to celebrate the role of pharmacy in shaping health outcomes, but also the opportunity to reflect critically on the future we must create. This year's theme, Pharmacy Beyond Dispensing, Financing and Optimizing Supply Chains for Better Healthcare, challenges us to think differently about the role of pharmacy. It pushes us to go beyond the familiar image of the pharmacist behind the counter and instead to recognize pharmacy as an essential driver of healthcare innovation, financing, and system resilience. The truth is clear: medicines only change lives when they are accessible, affordable, and reliable. Yet, across Nigeria and many parts of Africa, patients, and even outside of Africa as well, patients and providers still struggle with stockouts, prohibitive costs, delayed deliveries, and fragile supply chains. Financing gaps continue to cripple hospitals, community pharmacies, and even governments as they strive to deliver care. These challenges are not new, but they are becoming increasingly urgent in a world of rising health demands, economic uncertainty, and emerging diseases. This is where the conversation of today becomes extremely vital. Financing is the backbone of access. Without adequate and innovative financing models, medicines remain out of reach for the people who need them the most. The question then becomes, how do we ease the burden of cash flow constraints for pharmacies and hospitals and anybody that requires pharmaceuticals? How do we create financing tools that not only keep shelves stocked, but also make treatment more affordable for patients? These are the questions that we have to answer very boldly today. Supply chain optimization is the second pillar. Every inefficiency in the supply chain, whether it's from poor forecasting, whether it's from bottlenecks in distribution or inadequate storage, translates directly into lives affected and trust eroded. A strong technology enabled supply chain can reduce waste, improve predictability, and bring medicines closer to the patient, whether in the heart of Lagos or in the furthest communities of rural Nigeria. At Medbury Pharmaceuticals, we have come to see ourselves not just as suppliers of medicines, but as enablers of access. Our commitment is to support the healthcare ecosystem with solutions that ease financial pressures, strengthen supply chains, and empower pharmacies to do more than just dispense. We empower pharmacists to do more than just dispense, but to advise, to innovate, and to lead. But we also know that no single actor can achieve this alone. It will take partnerships between government and private sector, between financiers and innovators, between academia and frontline practitioners. It will take policies that are bold and responsive, technologies that are fit for purpose, and above all, a shared vision that healthcare must work for every Nigerian and not just a privileged few. So today, as we begin this roundtable, I urge all of us to think beyond business as usual. Let us ask ourselves, how do we how do we build stronger supply chains? And most importantly, how do we expand the role of the pharmacy so that it becomes a true catalyst for universal health coverage in our country? The future of healthcare in Nigeria and indeed in Africa will not be written in clinics and hospitals alone. We can't do it alone. It will be shaped in the networks of pharmacists, in the flow of supply chains, and the strength of partnerships that we are building here and now and we are building today. On behalf of Medbury Pharmaceuticals and the entire Medbury Healthcare Group, I thank you all for your commitment and for joining us in this journey. Together, we can take pharmacy beyond dispensing and in doing so, deliver better healthcare to every community that we serve. So I just want to thank you all again for joining us and coming today as I I usher you back into the program. Thank you very much. I'm really looking forward to a very fruitful discussion today. Thanks a lot, everyone.
Thank you very much, Doctor. That was a brilliant submission. And thank you for the kind words to pharmacists across the entire world. Okay, so we'll jump back right into the conversation. And I was just going to bring in Abiola Oshunuyi, who is a digital health expert, and ask you a very important question, which has been, on the minds of several pharmacists across the world, which is um, how can digital health solutions be leveraged to optimize pharmaceutical supply chains and ensure real-time visibility of drug availability?
Thank you very much, Ayo, and it's great to be speaking. And I kind of align with the CEO of Medbury Group on wanting to affiliate with the pharmacists on this very wonderful day. But one thing is quite striking. It is usually what I see with technology or or the use of technology in healthcare is not for the lack of the availability of technology, but really how we want to adopt or adapt technology to the context. So I give a typical example. Today, you find out that in things like, with fintech or with as simple as transportation, there's something you call a tap and go. You could just get somewhere, tap somewhere, and you basically are able to make a transaction or move things quickly around. And you're able to actually connect end to end. So at that point, the customer, in this case in healthcare, the patient, is able to actually, for the sake of drugs and commodities, is able to see, say the amount of commodities they bought or the prescription they have. The pharmacist is able to see that prescription, and then eventually all the way to the manufacturers and of course to the regulatory agencies. They're able to see, conversations or interactions around commodities. So, for instance, if you do have maybe a sort of adverse drug effect and or adverse drug reaction, the report happens. Now, all of these frameworks that we want to borrow in healthcare already exists, fundamentally in every aspect or in technology today. So, and I would, sort of speak to the different technologies and that have been, kind of embraced in healthcare as well. But what I want to kind of really talk around, or I liked, is the fact that how we choose to adopt technology, or how we have chosen to make technology a part of ourselves, is actually more important than the technology itself, because technology in itself is an enabler. And it will enable whatever you want it to enable. So, for instance, today we were talking about end-to-end visibility. Today we have what you call a paper system, right? You capture data on paper, with the bin cards, with the inventory sheets, and then those are kind of, put into registers. With a digital system, what you have is you do have an inventory management system and, slash a logistics management or logistics information management system, which means that I can actually see today, if I was in physical location Abuja, if I have distributed warehouses across the country, I can see the stock level of the different commodities, in this case, drugs that I have. And once I'm able to see that, as those drug levels are, being reducing, if there's a sort of replenishment protocol or practice, that can then actually happen in a almost semi-automated manner. Semi-automated in the sense that the trigger effect allows the central store to begin to just make arrangements and then push commodities to that, decentralized store, as it were. But what we've seen essentially is, there is fundamentally a little bit of the concept of people wanting to change to adopting the technology. Today we have IoT and real-time tracking. Real-time tracking with IoT or RFID tags, where of course many of us on the call have a mobile phone. I can actually track you with a simple app, and that's exactly how RFID tracking or IoT tracking is, where devices are GPS enabled, and the location of those devices can actually let you see where a particular item is. So in the value chain, in the supply chain value chain, you are able to actually capture specific data that is helping to know the quality, nature, and viability of commodities. So temperature, humidity, and in certain reactions or in certain context, if it is very important to you, the physical location and all those things that actually allow you to be able to say, is this commodity, within the allowable parameters for it to remain the quality part. There's the part of it that it also helps you, manage things like theft, spoilage, around that. And when you begin to look at that, you begin to hear on the back end that we're already generating significant amounts of data. And end-to-end visibility is not just about having access to large amounts of data. It's actually able to analyze that data for better decision making, and that's really what end-to-end visibility is supposed to drive. So today we have AI and large language learning that is being adopted for analysis, but we always add things like dashboards, that could actually help us see, stock levels, in almost near real time. And it's interesting to have Azuka on the call, because there were things that in the past that I do recall that even piloted in a couple of states on a couple of projects around using real time, dashboards to monitor stock levels of certain selected essential commodities as well. So today we have a lot of startups across the country. We have a lot of technology across the country that literally provides those kind of access for us. So and when you begin to look at it as well, people speak about the costs associated with adopting technology. So you do have, when you do use proprietary solutions, there's also the cloud-based solution, right? So of course, cloud-based solutions create the effect of where you are providing rent to use a service. But it gives you that ability to have access to high quality product, high quality service, fundamentally, that you're paying a token for. So essentially, you have a software as a service infrastructure. And so there's quite a number of technologies that today exist, from drone deliveries, like I said, to remote temperature monitoring. So there's a plethora of technology that that are exists for different aspects of what you call innovations, but have been adapted into supply chain. Many of us know about how the Amazon warehouses are right now, where they have automated robots that take deliveries, process deliveries, and then they transfer to drones, and drones are able to do those deliveries as well. So but that's on the very top level of automation. But if we look within our context, there's significant amount, even within the African context, a significant amount of some of those technologies that have been adopted. But in terms of, I think our focus should be on how well are we adopting or utilizing that technology to begin to drive change, and then begin to optimize accessibility, availability, and affordability of commodities. Yes, it will be expensive to adopt technology at first, but fundamentally, in the medium to long term, it becomes cheaper, because what you then are able to do is you're able to minimize wastages, spoilages, or denaturing of drugs. And then you are able to then predict, certain manufacturing capacities. So, for instance, you can have the process of where you are able to produce based on volumes for just-in-time approaches. And like the former speakers yesterday spoke about, where the manufacturers then have an idea of what they are producing for. You can have arrangements with government, with the private sector. You are not just producing en masse for a market that you don't have an idea for. You already understand consumption. You already have visibility for that consumption, and you have enough data that can allow predictability of the market, which then allows sustainability in the market. And that's where you can then begin to talk about innovative financing. That's where you can begin to talk about can you put some level of commodity insurance, right, for patients directly. That's where a private sector person, or a private sector investor will be looking at healthcare commodity value chain as a viable place to put their money. So it's a conversation around, there is available technology. It's how we're adopting that technology for driving
Thank you.
financing and
Thank you.
availability of commodities on the continent. Thank you very
Thank
much.
you, Abiola. That's a fantastic submission. I'd like to very quickly bring in Famazuka Okeke into this conversation, who has wide experience in supply chain management, and to ask the question, as a leader in supply chain management, what practical strategies can be employed to ensure the efficiency and minimize wastage in drug distribution?
Okay, thank you very much. First, can you hear me, just to be clear?
Yes, yes, you're absolutely clear.
Okay, so first, Yawande has called me out, or is it Dr. Tunu? And then I also hear Abiola runaway soldier. It is well. Anyway, being called a supply chain leader in Nigeria, that's also a setup. But let's talk about practical strategies. I do practical, and I'm going to talk about what already we're doing in the country. I mean, in Nigeria now, I could say that considering what's happening in the ecosystem in the public health sector, I always call it the Trump effect. I think we're doing pretty okay. And this is really because we are really looking at practical things that we can do, low hanging fruits. And efficiency is no longer about just about moving boxes faster. We're not talking about looking inside a company. It's easy to talk efficiency in a company, but when you're talking about the public health sector, government-led sector, there are three key things you have to look at. One is that we must begin to build smart, resilient, and ethical supply chains to prevent wastage, protect our clients or patients, as we may call it, and also prepare for shocks, because we all saw what happened during COVID. And it's quite complex. Abiola is here, so I'm not even going to talk about technology. And I like that he has actually dwelt on that. And I think Yawanda said we have moved from the pharmacist role in dispensing. One of the key things that we must begin, or two of the things that we must prioritize if we really need to reduce waste, I always say collaboration and governance. You cannot run from governance. Governance is the heart of supply chain systems led by government. And I like what Nigeria is doing now through the National Health Supply Chain Strategy. 2021, initially it was to end 2025, but it's being extended to 2030, the year of universal health coverage. It actually says that every state, and I love that because we are a federation. People always talk about the president, the minister. I'm like, we are a federation. The costing, the financing for medicine access sits within our governance. So the national health strategy is actually saying every state government must build a procurement body. When we have state procurement bodies, then we consolidate procurement. What does that do? It reduces waste. When you have a procurement body, one central body to buy medicines for a state, that's when we start talking about practical waste reduction. That is where we talk about being sure we institutionalize governance frameworks within every state. If your state does not have what we call a drug management agency, you should go talk to your governor. Two is, if you have that governance mechanism, then you can begin to track things like stock out rate, wastage levels. Technology begins to make sense. If you don't have a one central port of procurement and distribution, what are you going to track? So I always tackle people when they say technology, use this system. I say, you don't even know what the issues are in Nigeria. We need a standardized institution where you can hold a system accountable for whatever we're tracking. So that's one practical thing we can do. Every state has to have a drug management agency. Ask yourself, does my state have a drug management agency? The other thing we must do when we're talking about strategy is collaboration. First is, like, I think for last year or the last 2 years, Global Fund built massive warehouses in 21 states in Nigeria. Ask yourself, what would they be doing with that warehouse? If we have a warehouse, we must begin to make sure that each state can actually share warehousing capacity. We don't need companies or manufacturing firms to be in every country, every state. But if you have a manufacturing plant in Lagos, why not go and co-share warehousing facility in those 21 states? You don't need to build warehouses. Those are the waste we're talking about. We have massive government-owned warehouses. They must be turned to co-shared warehousing space. Then we reduce waste. We must begin to even move from individual state procurement to group purchasing. Yawande mentioned it. That's where we're going. Imagine where states in Nigeria pile their monies together. Kano State does procurement of around 9 billion every year. Kaduna does like 4 billion every year. We have other states that do, I think Jigawa does like 7 billion. This is Naira, billion. Oh. Now imagine if states pile that together and pool procure. We reduce waste, economies of scale. There are real practical things we can do today. Everything, again, sorry, Abiola, but everything is not always about technology. There are practical things we do now that can give Nigeria a better positioning for any shock we're going to have. So again, we talk about you cannot run from public-private partnerships. We just can't. Distribution, we can warehouse, we can, but I always say to government, please outsource. Partner with third-party logistics companies to distribute. Partner with even the pharma companies. Let's not duplicate efforts. So these are some of the things when you're talking about practical things to do about waste in Nigeria. We can do these things now. So yes, I think these are some of my submissions. Thank you.
Thank you very much, Famukeki. And I think this is the perfect place to drawing, a hospital administrator into the conversation. And I'd like to quickly ask Dr. Ogumbo, who is the medical administrator for our Jalad Hospital. And from a hospital administrator standpoint, how can pharmacies and hospitals collaborate more effectively to deliver integrated care beyond drug dispensing?
Okay, thank you for having me here today. And also, I'll borrow words from Yewande and Abiola. From the hospital space where I operate from, I've heard a lot today. So if you look at what Yewande said initially, that the pharmacists, they are not just dispensing medications, they are part of the team. So she called them the part, they are part of the care coordination team of the hospital. And also listening to what Abiola said, that even Yewande also highlighted it, that technology is an enabler. So if you look at that together, these days, pharmacists haven't gone to school for 6 years. You don't expect them to come to the hospital setting and just dispense medications. So one of the ways that they can interact and be more efficient in the hospital setting is to allow them to have access to clients' data. That is, they have access to records, hospital records. So when they have access to records, starting from the outpatient department, you realize that when medications are prescribed or doctors have written their notes, they've written medications for patients, the pharmacist is able to see these patients' notes to identify issues that border around things like allergies, and also understand if this patient, the medication that have been prescribed, if the dosing is even adequate, because now they can see the patient's notes. Gone are the days where you just, the days of paper record keeping, where the only thing that gets to the pharmacy is just the prescription notes. Now the pharmacist can see the whole note. That's why I was trying to borrow from what Abiola said, that technology is an enabler. Now the pharmacist can see the medication, the patient's notes, and they can also understand the age, the weight from this note of the patient, and calculate appropriately the dosing for this patient. That's from the outpatient perspective. And also, again, doctors just write medications, and sometimes if the pharmacists do not have access to the patient's notes, understand where the patient is coming from, they are unable to counsel the patient appropriately. For example, a patient might never had the medication before, and they're prescribing the medication for the patient for the first time. And if the pharmacist have access to the patient's electronic medical records, and also they are aware that this is the first time the patient is taking this drug, they are able to counsel the patient appropriately. Peradventure, there are side effects, that can happen from taking the medication, so the pharmacist can counsel the patient adequately. That's also how technology can enable, and the pharmacist is not just one that is dispensing medications, but also participating in the care coordination for that particular patient. Go to the inpatient perspective. These days we encourage pharmacists to join rounds, and again in Arjulad, they join rounds when the doctors are doing their rounds. Sometimes they call it grand rounds. So when they join these rounds, it's easy for them to contribute in aspects of medication availability, reducing the prescriptions, and from the doctor's perspective. So sometimes the doctors might want a particular drug, and those drugs might not even be available. So when the pharmacists, they are part of the ward round, they're able to tell the doctor and also offer alternatives, profile alternatives for the doctors to choose from that are readily available in the hospital formulary. Hence, they are helping to reduce unnecessary delay in the care of patients. So there's a whole lot that the pharmacist can do beyond just dispensing medications. And also another thing that they can help with, there's this thing that is raining everywhere in all hospitals that are trying to do quality. They're talking about antimicrobial stewardship, whatever that is, if you understand what it is. You see, if the pharmacists, they are part of that ward round team, and they are able to tell the doctors whenever a patient is on a particular medication, an antibiotic in this case, and the antibiotic is not available, they're able to guide the doctor with an hospital formulary to know what to prescribe and how to prescribe, so they can streamline what they're trying to achieve in the quality department for the hospital. So there's a whole lot that the pharmacist can do beyond just dispensing. And just to buttress what Yewande has said, they are care coordinators in the hospital space. Thank you.
Thank you very much, Dr. Ogumbo, for those thoughtful submissions. I'd like to bring in Famokeke here again, because she talked about local manufacturing earlier on. And I just wanted her to sort of shed light on how critical local manufacturing is, and sourcing in achieving sustainable pharmaceutical supply chains in Nigeria, because I know that a few people have argued that one of the reasons for the escalating prices of prescription drugs in the country is largely because most of our drugs are imported and very little is manufactured locally. So I'd like you to touch on how important local manufacturing and sourcing is in achieving sustainable pharmaceutical supply chain.
Okay, thank you very much. And again, even talking about what today is about, Pharmacy Day, it's critical for us to know that some of the evolving roles that we've seen pharmacists play today are the kind of roles I'm playing, which is really about, you could call it pharmacy consulting, you could call it, more pharmacists are going into supply chain, procurement, and then you begin to see that because pharmacists are playing in that role, one of the things we've done is to make sure that we have let the world know that manufacturing is part of supply chain. It is not a part that is outside the chain. You have to manufacture, then you move it into warehousing, then distributing, then it goes to Dr. Ogumbo here in the hospital. He gets it, and through the technology we have in the hospital that the likes of Abiola they put in place, we track what our patients are getting. We are all part of that chain. So we like to say to manufacturers, you are the starting point even before you bring in those commodities from outside the country. You are part of that chain. What does that mean? That means local manufacturing is not just simply about producing drugs within our borders. It's really about securing our future and even the future of the practice. A sustainable pharmaceutical supply chain for Nigeria cannot even be ignored, and it is deeply rooted in locally competitive regionally, and connecting our manufacturing even globally. This is our future. And these are the things I've been talking to PCN, PSN about. I said, when we meet, we must begin to open the eyes of young pharmacists to pharmaceutical supply chain. It is not just something that pharmacists should be interested in. It is that the sustainable access to medicine sits on us. It's securing our future. So local manufacturing is part of that chain. And it's so critical because it's actually, currently we are still importing, I would like to say 60%. Data online says 70, but no, we have actually improved local manufacturing. We are now at 60% importation. That exposes us critically to forex volatility. Then that means that we constantly have these global supply chain shocks. And that's why we're having the fluctuations in prices, the rising logistics costs. Currently, even now, even with all the executive order that Mr. President has put in place, customs, how we clear our commodities through customs, those are the things that actually affect logistics costs. So as long as we are still importing almost 60% of our medicines, we can't control the prices. That's just the reality. So we must, a matter of urgency, support local manufacturing. That's what India did. And now India is a global giant. I had today in my office someone from India, Lincoln Pharmaceutical, talking about penetrating Nigeria. And they have forex advantage. If we don't expand our Nigerians' local manufacturing, we're also going to now have even India take over our market. That's the reality because they have forex advantage. So we have to, as a government, support local manufacturing. And I take it back to our state government. It's not just a national government priority. Again, ask yourself when you get home, as a pharmacist, what is my state doing to expand local manufacturing for my state? Those are the critical things we have to begin to do. Building local production capacity reduces dependency. I would even say for a state, we don't have I would even say 90% of manufacturing happens in Lagos. Think about that. Happens in Lagos. So we are actually at the beck and call of Lagos. That shouldn't be. So if we need to even internally reduce dependency only to Lagos, we have to spread local manufacturing across Nigeria. As a country, it secures our national health sovereignty. Health is business. I am very much against a country 90% dependent on any donor system. No, I don't believe that. Health is business. Global public health made America one of the biggest economies. They are global pharma. They dominate the world. Health, pharmacy business is critical for our national health sovereignty. So I am very much a proponent of local manufacturing. That's going to make us richer. That's going to make us wealthier. It also strengthens our resilience against crisis. Imagine if we didn't even have the local manufacturing facilities we had during COVID, we would have been doomed. I like to use that term. It would have been terrible. So I think we must understand the critical need for us to look at manufacturing as one of our major wealth creation opportunities. And imagine how that will position pharmacists. So please, for everyone in this room, again, go practical. Ask your state government, how are we manufacturing? Can't we manufacture in this state? Must it only be in Lagos? So yes, it's critical to not just national sovereignty, but also states, because we are a federation once again. Thank you.
Thank you. And I'm sure that Medbury is taking a lot of lessons because they also would be swinging into manufacturing very soon, and I hope so. Abiola wanted to touch on a few words that as a follow-up to some of the comments that you have just likely made. Abiola, you have the floor.
Thank you very much. And this is quite interesting. And I hear this every time we speak, when we speak to policies, strategies. And I like what the doc from Arjolat said, and I want to highlight it again. Technology is an enabler. And by saying that, I say that because there's significantly no economy in this world as of today that did not enable itself with technology. I just wanted to put that on the table first. The reason why in the last 20 years, companies that have not existed before have been able to come on board and then outperform other companies is as a result of the utilization or the adoption of technology within the new framework. That is number one. Number two, we know the stories of things in fintech, and I'll use example. M-Pesa, for instance, today Nigeria is one of that in fintech use things like the NIPS, instant payment resolution, as different from the world. What I'm saying is have a perfect roadmap, basically be able to adapt into healthcare, in this case, supply chain. For instance, if we remember the days, and I just want to cast your mind back in the days of finance, the banking industry. Today we are talking about banking consolidation of billions. We're talking about fintechs, led by people that are less than 40, do transactions of over a billion, dollars annually. The reason that can be done is because there's something enabling it, and that is so for us to be able to identify first points of weaknesses and also points where we can be able to accelerate growth and leapfrog, we must be able to see that adoption of technology is there. That's one. In the manufacturing space, and whenever we're talking about universal healthcare coverage, there's something we kind of miss, and I like what Azuka said when she spoke to sustainable supply chain, right? In just even tracking your supply chain, whether it's sustainable. For instance, I've worked in the financing sector today, where the financing sector, by regulation and by also voluntary aspect, they report on their sustainability matrix within the value chain. So, for instance, gender distribution, things that are somewhat, sometimes even local to healthcare, are part of things that are being reported on. How many people on the board that are male, parity, the amount of females on the board, the pay gap and things like that. And you then look at the different aspects of the SDGs and other specific aspects of sustainability, emission levels, and all of those. Now, if we then cast our mind back, and I just wanted you to look at this, how have we structured our supply chain where we can actually, from life sciences to specifically patient-centered, because the African genome is probably it's not probably, it is the most richest genome on the earth that has 100% of what you call the authenticity of man. How much of that have we researched into on the African continent, that we are then able to make drugs within the continent? We are dependent on IPs and intellectual properties and different solutions for drug medications and manufacturing at almost a 90 to 95% level. I dare say that from other parts of the country. The vaccines, how many vaccines do we manufacture locally? And those that we manufacture locally, how many of them have we been able to significantly ramp up? Now, all of these things speak to a couple of things. Underpinning this is, one is around the willingness for us to be able to say we run this beyond just an invention, which brings me to the point of, because we have taken healthcare, generally in the country as not an enabler, an economic enabler, a GDP growing component. So if health was seen as a business, and I like the way Azuka said it, that supply chain is a business and there's a business of commodity management. If healthcare itself, which is the real enabler of what you call healthcare supply chain, is seen as a business, there are a few things that it would enable, right? Because it then creates the regulator as a facilitator, not just as an enforcer, because he's then able to unbundle the market to allow specific people step into the market and then be able to fast track certain things. Now, in the concept of PPP, the reason today, if we ask why a lot of companies, look, there's infrastructure issue, right, would not want to invest in certain aspects, is because if I don't have visibility of certain things, if I'm not sure of certain things, I won't invest in that place, right? And those that have invested there, if you go back and check, the sweat, blood, and tears, some is completely commitment, some are able to break even, and you see, some will look at it and say, at the end of the day, if a new importer and or a new wave of donor funding, and maybe the donor fatigue might be a good thing now. Donor funding comes. It comes with the concept of commodities are bought on the other side. Now, so if we're speaking around the conversation around, manufacturing in of itself of commodities, we then need to step back even further beyond manufacturing. And if we want to speak about sovereignty, then we begin to talk about how much have we invested in the country in life sciences, how much research and development. We do have local knowledge on, health for care, for health. And, just taking that as an example, how much have we been able to modernize those local knowledge? And all of those things that I speak to technology. Technology is not only about an EMR that is capturing data. Technology speaks to genomics and multinomics, right? When I'm able to basically go into the human genome and do genome editing, the DNA editing, and then be able to create a specific drug that is focused on maybe, an RNA deleting or to manage a specific particular drug, maybe a cancer or an NCD. Now, so if we don't begin to see, healthcare first as an enabler, and then see it as an economic value higher than just, we're providing a social service, or we are saying supply chain should be efficient for public service. When public healthcare or public care or public health is seen as it is contributing, say, 5%, 10% of the GDP of Nigeria, and I like what Azuka said, that public health discovery. But on the back of public health discovery of America is life science and investment in life science. If you check how much America votes for the NIH today, and to the US CDC for different things around national health security and discovery of new commodities, the amount of patents that are being filed on a daily basis, which is led by technology, you would understand that every single time we speak to manufacturing, once we are going to be dependent on an IP from an outside, or do not have data, because we do have data, that data is sitting in silos. If you see today, every time a new agency comes up, you register for multiple things, but you have data. You have data in your secondary school, primary school data for education. You have school absenteeism. You have the reason why the child did not come to school. You have data from clinics and movement of people. You have data from PPMVs. When you start putting all of that data set together, you begin to see better visibility. And there's no way you can actually pull all that data set without you leveraging, significant technology. So today, when we don't put certain aspects sitting to one side or the other, right, we begin to lose out on the possibilities, because what we're playing right now is catch up. We play catch up in one country. We need to position ourselves, leveraging every resource. We have human, we have intelligence, and there's technology.
Round up in 10 seconds. Oh, you ran it up already. Okay.
Yes,
okay.
I have.
Okay, thank you very much. Thank you. We're pressed for time now because we should have rounded up at 5. So I'm going to give about a minute each, to the panelists to give their final thoughts, before I yield the floor to Medbury to give us a closing, remark on this. So I'll just quickly go through the panelists to give their final thoughts, and I'll just welcome, from Yewande Adekoya to give a closing remarks, and we can call it, a day. So in a minute each, I'll start with Dr. Ogumbo. Your final thoughts on this, the theme of our conversation, and what you're going to be leaving the audience with.
Okay, for me, I just want us to know that we need to collaborate in the healthcare space, because just like what Asuka said, if we have efficient supply chain system in the healthcare space, we are not just being efficient, we are also securing our future. Yeah.
Oh, that was faster than I thought. Thank you very much for that. Famukeke, your final thoughts?
First is also to remind everyone that health is business. It's very important that we do not see health just for impact. Health is business for impact. And pharmacists are so well positioned today in Nigeria, in Africa, to actually be the transformation body that the country needs. Because if you don't have access to medicines, then you are really in for a very difficult time as a country, particularly now with evolving diseases and everything. And finally, supply chain like technology is just an enabler. What everybody wants, what all the clients want is, if I come to the hospital, I see a doctor, I see the lab person, I go to the pharmacist, I collect my medicine. It's just an enabler. We must prioritize that patient, that client getting what they need when they come to the hospital. Thank you.
Thank you very much. Abiola?
Achieving universal healthcare coverage without any doubt requires, like everybody has said, collaborate. Beyond collaboration is today we do have examples based off of data that we can use. We should backward integrate. We should understand where the issues are, and then be committed as a country to unbundle and address those issues beyond just a national problem or a state problem. We should see it as a Nigerian growth agenda issue. So pharmacists sit at that center, and everybody within the health sector sits in that center as a catalyst to economic growth because we sit on billions of dollars as a country because of the African continent, and everybody looks to Nigeria for growth on the continent. If we can do it right and get it right as Nigerians, Africa, and the Black world, we get it right. Thank you very much.
Thank you very much, Biola. I thank you to all the panelists who've taken time to join this very important conversation. It's been very enlightening. It's been very enriching. It's very educative. And I'm sure that all of whom have tuned in to listen, it would have been worth their time. I'd like to quickly cede the floor to Yewande Adekoya, who is the head of business for Medbury, to give her final thoughts and her closing remarks, and to also commend them for putting this very thoughtful conversation together. Yewande, you have the floor.
Thank you very much, Mr. Dale. Thank you to everyone that has been part of this conversation. I would like to first thank our panelists who, out of their very, very busy schedule, made out time to be here today at this crunch time. Thank you, Dr. Ogumo. Thank you, Pharmacist Azuka Okeke. Thank you, Mr. Abiola Oshuni. And I want to thank my MD, Group CEO of Medbury Healthcare Group, for making our time. She's in between flights, right, to show up for this conversation. I would like to thank the team that put this together, right, for making this happen. I want to appreciate everyone involved. This was a very thoughtful and well thought out and also seamless process. I want to thank everyone on the show that are here that have been part of this conversation from the very beginning. I hope that you've been inspired, you've been impacted, you've gotten some level of knowledge in terms of how to make the pharmacy supply chain, pharmacy practice beyond dispensing. And I would like to leave this thought, right, to say as we celebrate today's World Pharmacist Day, I would want us to remember that affordability is as important as availability. And without financing, access breaks down. The future of the pharmacy practice and supply chain basically lies, just like what everybody on the panel has said, building collaborative, data-driven, sustainable systems, policies, models that ensures that no patient is left behind and the right medicines get into the hands of the right patient at the right time, at the right cost, and at the point where it is needed. And at Medbury Pharmaceuticals, we believe strongly that supply chain financing is not just a business. It is business. It's for impact, just like what Azuka said. It is also an health equity tool. And that's when pharmaceutical companies, government bodies, hospitals, and communities come together, they work together, the patient wins. And that is the real bottom line. So as we look beyond dispensing, let us commit to making pharmacy the true front line of healthcare, where innovation meets compassion and empathy, and where every patient, regardless of status, regardless of who they are or tribe, they have a fair advantage and fair chance at health. Thank you very much. And once again, happy World Pharmacist Day to all the pharmacists in the house. Thank you very much.
Thank you very much. Thank you very much. And we can call it a day. Enjoy the rest of your week. And we'll do this again on World Pharmacy Day next year. Thank you.
Yes. Thank you, everyone. Bye.
Bye.